there. In this lesson, we're going to be talking through the diagnosis of impetigo. Impetigo is a rash that children can get, and it's very, very contagious. So what we're going to do is talk about what to look for to make sure you can recognize it, and then also just what to focus on in your nursing care. So impetigo is actually the most common bacterial skin infection for kids ages 2 to 6 years. And the types of bacteria that we most commonly see cause this rash are Staphylococcus aureus, so a staph infection, and then also a group A strep. So staph and strep are the two that we're looking at here. And I just want to highlight really quickly that I said group A strep, and that's different than the group B strep that you've probably come across in your OB classes. Okay, so let's talk about what we are looking for when we're assessing impetigo. So impetigo is going to have a non-bullous rash, which means it has pustules and vesicles. There's also a bullous impetigo. It's less common and less contagious, so we're not focusing on that one, but that one's characterized by having blisters. But the non-bullous has pustules and vesicles. Typically, the non-bullous impetigo is found around the nose and mouth. That doesn't mean that it can't be other places like hands and feet, but it's usually around the nose and mouth. And the thing that really stands out about this particular rash is that once those pustules burst, they excrete a honey-colored fluid that leaves that characteristic crust that's really unique. You're not going to see that with other rashes, so looking for that honey-colored crust. And just a really good example that's a little bit gross, but it does describe it very, very well, is that yellow crust can kind of look like little corn flakes that are stuck to the skin around the mouth. And so we've talked about the rash, but what about the patient? So the patient who has impetigo is actually pretty fine. They're systemically well. There's not going to be much else to find on an assessment other than maybe some lymphadenopathy, which just means that their lymph nodes are a little bit swollen. And so just to clarify, what do I mean when I say that a child is generally well? Well, this means that they don't have a fever. It means they're eating, drinking, peeing, sleeping, all those things that mean that a kid is fine. So they're generally well. The rash is not painful, but it may be itchy, and we're looking for that characteristic honey-colored crust. Okay, so our therapeutic management of impetigo centers around wound care and antibiotic therapy. Our wound care is just going to be all about keeping that wound clean and preventing the spread of the infection. Like I said, it's very, very contagious. So mild impetigo can be treated with a topical antibiotic, but if it's widespread or it hasn't responded to topical antibiotics previously, then the patient will likely need to go on oral antibiotics. And most of the time, if it's uncomplicated and the child's fine, impetigo can be managed in the outpatient setting. So a lot of what we're doing as nurses is just going to focus on patient education. But if you do see it in the hospital, just remember that impetigo, very contagious, spread by contact. The patient should be placed on contact precautions, and you got to make sure everybody's washing hands really, really well. If the patient's at home, what we're going to be instructing caregivers to do is to keep that wound clean. They can wash it with antibacterial soap, and we really want the child to not scratch it, keep those nails short. We don't want it spreading to other places on the body. If they are prescribed topical antibiotics, what we want to make sure they know to do is they need to wash that rash, and they need to make sure that they remove the crusted scabbed areas that we talked about. And that's going to make sure that the ointment can actually get to that skin and be really effective. And then again, preventing this contagious infection from spreading. These family members should not share towels. The child should also be kept out of school until they've been on antibiotics for 24 hours. So washing linens, making sure that it's not spreading in the household is very, very important. Okay, so that covers the basics of impetigo. Pretty straightforward, right? But what I want to do now is just talk a couple of minutes about a complication that can occur with this rash and with that bacterial infection. So just really quickly, this complication is called acute post-streptococcal glomerulonephritis. So lots of words there, but let's just break it down word by word. So by acute, we mean that it has a sudden onset. Post-streptococcal just means that it's happening after a streptococcal infection. And then glomerulonephritis means that the glomeruli, which are tiny little units in the kidneys that filter the blood, those glomeruli have become inflamed and irritated. So basically, it's an inflammation that occurs in the kidneys after someone has had an infection that was caused by a strep bacteria. So it's not the actual bacteria has come into the kidneys, but it's the body's immune system getting confused and accidentally attacking itself. So we're getting kidney damage related to that strep infection. So a couple things to link in here. This means that not only can impetigo cause this, but other strep infections as well, like strep throat and scarlet fever, can cause this post-streptococcal glomerulonephritis. And usually this reaction happens 10 to 14 days after the onset of the initial strep infection. It can happen in adults, but it happens very, very rarely in the adult population. So it's pretty much only covered in your peds courses. And it's most common in kids ages 4 to 12 years of age. So because those kidneys are damaged, what we're looking for in terms of a presentation are edema, hypertension, and hematuria. So this is the triad of symptoms that you want to be aware of for acute post-streptococcal glomerulonephritis. So if you ever see a kid with edema, hypertension, and hematuria, it should really stand out to you because these are not the kinds of symptoms that we see every day in kids. So if you do see it, just remember to ask about recent illnesses because it could be that their kidneys are damaged from a strep infection. So I know that's a lot to take in, but that's a really important complication that is very pediatric specific and not likely to be covered anywhere else. All right, your priority nursing concepts for a patient with impetigo are going to be infection control and then tissue and skin integrity. Okay, guys, that's pretty much it for impetigo. Like I said, pretty straightforward. We're going to go over these 3 key points for you, and all of your patient education and nursing care pretty much stem from the 3 facts that you see here. So first, remember that impetigo is a bacterial rash. And so from this, you should be able to remember that it's treated with antibiotics, that its common causes are strep and staph bacteria, and then lastly, that you could get that complication of acute post-streptococcal glomerulonephritis from the strep infection. Number 2, don't forget that it has a very unique presentation, which means it's very testable. It has that unique honey-colored crust that's usually around the mouth that can be itchy, but it's not painful. And then number 3, remember, it's very, very contagious. So your nursing important things to do are infection control. They need to be on contact precautions, and then make sure you're getting that patient education in to prevent it spreading to other people in the family. Like I said, if you just remember these 3 things, you'll be totally set. All right, that's it for our lesson on impetigo. Make sure you check out the resources that we have attached. Now go out and be your best self today, and as always, happy nursing.